Welcome everyone to this wonderful webinar with Experience Dermatology. We are here to announce our brand new treatment, UltraClear. This is our virtual launch event with Dr. Zachary Iyer and Adriana Santiago. If you have any interest in laser treatments or in skin rejuvenation, we're going to explain what this laser is all about, what it can be used for, why you might consider it over other treatments, and why we're so excited for this new device. We do also have a promotion, so make sure you stay tuned until the end of the webinar and we will explain how that works. Before we get started, let me introduce you to our wonderful speakers. I'm pleased to introduce Dr. Zachary Iyer, who is a board-certified third-generation dermatologist and opened up Experience Dermatology back in 2024. Dr. Iyer brings a comprehensive perspective to patient care, combining clinical expertise, business training, and deep understanding of the patient experience. And we also have Adriana Santiago, who is a licensed medical esthetician and is the lead clinical esthetician here at Experience Dermatology. With extensive experience treating all skin types, she is known for creating customized, honest, and judgment-free treatment experiences that help patients feel confident in their skin. Without further ado, Dr. Iyer and Adriana, the floor is yours.
Awesome. Thank you so much, Holly, and welcome to everyone who's logged in with us. Appreciate your guys' support and also your wanting to know more about this UltraClear laser that we brought onto the practice. As Holly kind of mentioned, we opened up a year ago and really looking for technology that we could bring on that, number one, delivered a really good patient experience. Obviously, the name of the practice is Experience Dermatology because that's our focus. So that was paramount. But then not only a good experience, but the results, and that's part of the experience, is really trying to find a technology that isn't nothing. Some treatments out there, they just don't have the results that people really want. You have a problem, you want to find a solve, a fix, and this UltraClear device, as we're going to get into the technology, really can deliver those results, and it's very versatile. So I wanted to bring on something that good patient experience, good results, but also is some of the cutting edge technology that, and we'll get into why it is. But certainly this is the next frontier. This is kind of the beginning of a new line of cosmetic and device procedures that I think are it's going to catch on. This is the kind of we're not the earliest adopters to this, and I never want to be the first to the show. Because I want to provide things that have some track record, that have some really proven results. And this has already been around for a couple years now, just starting to kind of come into the forefront of these treatments, and this is exciting because I think this is really going to be the future of laser resurfacing and laser treatments. So this is a little video. It's going to describe some of the things I talked about, and we'll go into more detail.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs, balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
Awesome. So that video hopefully showed that they said it 3 or 4 times. This is a safe laser for all skin types. Now, not all lasers are like that. and we're going to get into why that's the case, and where this device really shines. But there's a few different kind of things that does make it unique, and that video highlights some of them, but I want to kind of more tease out some of those. Number one is the comfort. Typically with resurfacing lasers, anything that delivers a significant amount of energy that can cause disruption of your skin barrier, it's painful, as you can imagine. Now this laser, it doesn't have no pain. It kind of said no pain. There's a little bit of pain, but it's less, significantly less than the majority of lasers that do this same thing, the older technology. So it talks about cool pulse. What it's able to do is able to deliver, and we'll go over some slides about this, but it's able to deliver the ablation or the resurfacing without as much heat. Heat in the skin can cause a lot of problems. We use it to our advantage in some cases, but for comfort, typically topical numbing medication, just like in this number 3, quick and convenient topical medication, that's already all you need for this laser, even for the more intense therapies, which is very, very cool and not very common for this level of therapy. The other kind of mode that it talked about, it had these four little modes that it came up with on that video. And it's really important, and we're going to get into why that's important. There's a wide variety of options we have to treat certain skin issues. It talked about wrinkles, pigment, texture, scarring. A lot of the times, 15 years ago, you'd have to have 4 lasers to treat those 4 different things. And as time has progressed, we've been able to kind of figure out different ways to treat those concerns with a similar approach or a similar different wavelength to this laser. So this one really can attack all of those problems. And there's some of them it attacks better than others, but it does, even if you're not going in for the color of your skin and a little bit of discoloration, when we're going after scarring or texture, when you're doing one of the therapies, because this can treat all of those things, you do get improvement in all of them to a degree, which is awesome, which is super helpful. Minimizes having to do 2 or 3 different types of lasers to get that effect. It really can get you there. And certainly this is something that we can do on multiple areas of eye. Most of the laser treatments, we're focusing on the face. So this is the place where we're doing a lot of cosmetic treatments, as well as scarring, acne scarring, other type of surgical scars. But it can be done anywhere on the body, which is awesome. So that's why there's a really unique kind of way that we use this laser. The other thing that it really highlighted, which is amazing, especially here in Atlanta, most lasers you cannot use in all skin types. And the reason you can't is because that heat, the thermal damage that can be caused from these lasers can induce what we call post-inflammatory hyperpigmentation. It can induce melanin production, and it can cause some issues. So this laser has been tested, and there are protocols and things to use for all skin types. And this is pretty revolutionary. Not a lot of treatments can be done for scarring and texture on the darkest skin types. Typically, this is this kind of scale called Fitzpatrick scale that we use in medicine to kind of describe different skin tones and the propensities it has with sun exposure and other inflammation. So the lower the skin type, the type 1, type 2, and type 3, those ones can deal with a little bit more heat without causing disruption to the color of the skin. The type 4, type 5, type 6, too much heat can disrupt and cause a little bit more damage to the skin that can induce discoloration. This technology allows us to kind of bypass that thermal and that heat damage, but still allowing us to cause some remodeling of the skin. So really, really cool technology. And as I was talking about these different modes of this laser, and we'll kind of get into it a little bit too, but this is this very simplified diagram of the skin. The stratum corneum is the very top layer of the epidermis. Then you have your dermis, which underneath it provides some of that connective tissue. That is an area that if damage gets down into the dermis, scar tissue is formed, and that can be really difficult to kind of lift up and out. And then your hypodermis is right underneath your dermis, where your fat is, and some of the other connective kind of tissues are. The different depths that this machine can go allow us to do different things. Adriana's going to talk about this 3D miracle, or this very superficial remodeling of the very superficial skin, which really does a good job with a little superficial texture as well as color. So dyspigmentation, texture, a little bit of tone. And then as we come down, this ultra or ultra clear, as they call it, the ultra laser is where we're able to get down and remodel some of that deeper skin that's been damaged, especially with acne scarring, with deeper wrinkles, with a little bit of toning and tightening of the skin. And then the coolest thing we're talking about at the end is laser coring. This is where we can really get some depth down into these deeper structures that allow us to kind of remodel in some ways some of those really deep structures that are pulling, tugging, and kind of making the skin do things we don't want it to do. So this machine allows us to go from the most superficial to the deepest. And then there's other things that we can do in that to kind of tweak the way this laser. It's very customizable. This is not very common with most lasers. You really can't customize this much. And this laser allows us to do all of those things. So this is a kind of a graph that shows us all the things that can be done with the tone. I talked about the tone, texture, just skin health. There's a lot of lasers that do just a little juice, like a little bit of a glow. This can do that plus so much more for those really superficial treatments. The superficial 3D miracle or clear treatment. Sun damaged little spots, the little fun you had when you were younger, that comes up when you're in your 30s, 40s, and 50s, that makes you regret not wearing sunscreen. That can be helped with this. And then we talk about those fine lines, those deep wrinkles, acne scars. That's where this moderate, this clear, ultra clear mode, those are a little bit more intense therapies, a little bit more downtime. That superficial treatment, which Adriana will get to, pretty minimal downtime. The deeper we go, the deeper that laser cores down, the more inflammation we kind of set off, a little bit more remodeling, a little bit more downtime. But that's why I love this treatment, because it's not nothing. People sometimes will promise the moon with these really superficial treatments. They'll say they do all these things. To get the results you want, you have to go down deep. And the deeper you go, a little more downtime. But the wonderful thing about this, back in the day, you'd have to go under like general anesthesia. You'd have to get significant infiltration of lidocaine. You're doing nitrous oxide. All those things, we don't have to do that with this, which is amazing. Pretty miraculous. This is a little timeline of why I kind of said at the beginning. There's not been a lot of innovations in these laser treatments. A lot of the CO2 lasers have been around for 30, 40 years at this time when they first came out. They're still being used. CO2 is great. For some things, it's really good, but it has a lot of heat. Not everyone can tolerate it. Their skin can't tolerate it. It's very uncomfortable. Even the CO2 lasers that are out here, are good, but they just can't be tolerated. There are these non-ablative lasers that are a little bit more energy kind of focused, and then you have these. What the UltraClear does is pretty unique. The fiber lasers allow us to deliver energy without as much heat. You kind of have to be somewhat, I'll be honest, like a laser guru to understand the significance of that. But just know this is unique. There's no other laser that has this. This is really special. Cool. So this is going to get a little bit talking about that. They call it 3D IntelliPulse, but this what allows us to do this in all skin types. It's going to show these red arrows and these white arrows. And what the red arrows show is this coagulation or thermal damage. So when you're approaching the skin, you can add a lot of heat, which in some cases is helpful. We want to add heat because that's what sometimes tightens, gives us a little bit of a constriction here. But when you're dealing with color and complications, the heat can cause a problem. It also is really uncomfortable. It's like putting a hot poker on your skin. So having too much heat is really uncomfortable. So we can tune that heat. Some lasers, you just have one setting. This is the heat that you get. This is the damage you're getting. You cannot tune that up or tune that down. For this one, we can tune it up, as you can see, with those three red arrows compared to two or one red arrow. We can tune it up, tune it down. And that way we can really get remodeling in the way that's safest for the skin type, and also gives us the best, most comfortable results. So you don't have to, bite on a stick and scream out because we're burning your skin. We're able to reach those depths without the thermal damage. The reason is because the laser itself is geared towards water. This laser, we don't have a slide for this, but there is a very common slide that a picture that shows each laser has a different target. And these targets, whether it's pigment, water, red colors like blood vessels, and they all kind of cross each other a little bit. And so sometimes you get a laser that is focused on one thing, but it's so close to water, pigment, and blood vessels that it kind of does all three, but you don't want that all the time. With this laser specifically, it's geared towards water, and it really sets it apart from it. It doesn't attack the color pigment itself. There are lasers that do that, and we have those options here. IPL or intense pulse light does that, but this one is really geared towards the frequency of water. So it allows the heating up of water or the excitation of water, but it doesn't really hit anything else. So that we can really fine tune. And because it heats up it doesn't heat up, it excites the water in the skin. It destroys those skin cells that have that water in it right where we put it, and allows the skin to remodel and resurface, but in a very controlled fashion. And it doesn't really have all these other targets that we're trying to avoid when we're resurfacing and ablating the skin. Cool. So Adriana's going to talk about whether kind of you're a candidate, what we expect in terms of patient buy-in for this preparation. Going from doing nothing and doing a laser like this, it's kind of intense. But Adriana's going to kind of go over that for us here next.
Yes. So, of course, everybody is here because you're interested in UltraClear. But the question is, are you a candidate? Are you somebody who would benefit from this treatment at all? So, really, anybody is a candidate if you're looking to achieve a more smooth and even appearance. So, whether it's fine lines or slight pigmentation concerns, age spots, even active acne or slight acne scars, you're an excellent candidate. When we get into more deeper treatments like deep acne scars and wrinkles, everyone is also a candidate, but then it comes with the caveat your skin has to be prepared and your mind also has to be prepared. This is not a casual, everyday kind of treatment. In the office, we do facials and chemical peels and microneedling and IPL and laser hair removal. But the UltraClear is definitely our most advanced treatment and it comes with the most corrective results, which means we need to make sure that you are somebody who can tolerate this kind of treatment. So things to look for in a candidate in our consultation is really, have you ever had any kind of treatments done before? So have you, just had some more basic facials? Have you ever done laser treatments? Have you done more intense treatments like RF microneedling or Fraxel or BBL Moxie, Halo? All these kinds of things are important information to know if your skin is actually ready to receive the kind of trauma that UltraClear is meant to deliver, or if we need to kind of prep your skin more. So we have several options in office to make sure that you're the right candidate for this kind of treatment. If we go to the next slide, you'll see a video that is detailing what the treatment kind of looks like. So after we do our consultation, we discuss pricing, we discuss how many treatments you need and what downtime will look like for you, and then we bring you in. We numb your face for at least 40 to 50 minutes and clean it off super well, and then we get into the treatment. Here you can see it is ablating the skin. It is taking out tissue in the form of these circles that you see visibly on the skin. So this is what your skin looks like during the treatment. And then these are the kinds of spots that you may see on your face for a few days after the treatment, up to a week, 2 weeks, sometimes 3 weeks, depending on how aggressive the treatment goes. So it's very important to be mentally prepared for what your skin's going to look like during and after these treatments. You have to know if you have a Christmas party coming up or how far away your wedding is. All these kinds of things play into when you would want to get the treatment done and how aggressive we would need to go. But being mentally prepared for what it looks like and what it feels like is a big part of the treatment. During the treatment, like I said, we do topical numbing cream, but most of my patients have experienced not aggressive pain. I've done other treatments in the past on patients where they have stopped halfway through the treatment. I've had people crying during treatments before and just wanted to give up. So I haven't had that happen with anybody. This treatment is very, very easy to get through because of the new technology with those cold pulses. The heat is the biggest thing to get through. So this treatment cuts down on the heat. So it's cutting down on the discomfort that the patient feels, but you still get those incredible results. But with that, you do still have a little bit of downtime. So depending on how aggressive we go is going to depend on the amount of downtime. Patients with acne scars localized in certain areas, maybe they're just on the cheeks or just on the forehead, those areas will experience a little bit more inflammation or downtime after the treatment. And then I believe the next slide should show us the progression of healing. So this is a patient who got a relatively aggressive treatment. She got an UltraClear, and you can see immediately after, she's definitely a little flushed. The next day is when I call it the lobster phase. You're very bright red, a little irritated, maybe a little dry. And in some of those areas where we went more aggressively, you might notice some scabbing, some weeping of fluid from the skin, but it's all very minimal, and very tolerable. We give you tons of post care to set you up for success. So there's no question on what you can use, what you can't use. Everything is handled in the consultation, so you know exactly what to expect. The turnaround time is typically day 4 or 5 when people start to notice that their skin is looking human again. You'll have less red spots, less dryness. A lot of that scabbing will have gone away, and you'll just be a little flushed overall. And then within about a week to 10 days, again, every patient is different, every treatment is different. Within about a week to 10 days, you're basically back to normal. The skin is still healing over the course of a few weeks, but you do have that social downtime is cut in half to where a traditional CO2, you're absolutely out for about 2 weeks. With this, 3, 4 days, and you're pretty much good to go. So mentally preparing yourself for downtime is really key. The next slide is another photo of downtime from day 1 through day 5, where you can see another patient who is really red on day 1, day 2, 3, kind of red, but gets better after that.
Sorry, it's not advancing. Hold on. Sorry about that,
That's okay.
guys.
That's okay. We do send all of our patients home with a post-care kit. So again, it has all of like the cleansers, moisturizers, anything you need. If you've been researching this treatment online, I'm sure you've read about vinegar soaks or saline soaks. We set you up with all of that in a kit so that there's no question on what's clean or not clean. We love to send people home with Vaseline. And some people have Vaseline or Aquaphor at home, but don't use anything you have at home. Everything that we send you home with is exactly what you need to make sure that everything is super sterile. Because again, we are creating these wounds on your skin, and you want to be mindful of what's going into your skin. So after the treatment, we do avoid going to the gym. We recommend sleeping upright, kind of if your dogs or your kids are in your bed, to maybe have them out or sleep on the couch for a night to just really give your skin all the space to breathe, so that it is, not compromised by any of the allergens in the air, any dust, any, dirty kids' fingers touching your face, or, pillowcases, all that. We set you up for success that way.
Sorry,
And then
Holly, could you unshare the screen? It locked me out. I'm so sorry.
Yes, absolutely. All right, guys, we are live today. Sometimes
Yeah, no,
these
it just
happen.
happens.
All right, I just stopped the sharing. So if you want to go ahead and hit that share button again.
Yes, let me get, here we go. There we go. Oh, sorry
All
about
right, good
that.
work.
Yes. Beautiful. So yeah, so this is the second patient, her healing progression, and you can see like day 3 to 4 is a pretty dramatic difference. She's red, she's flaky. You can still kind of see those track marks. The laser can work in different shapes, and traditionally like a square or an octagon is used. So you may see some squares with some dots on your skin for a few days, but other than that, like very tolerable by day 5.
Yeah, this is incredible for the amount of resurfacing and the amount of damage that was inflicted. That's less than a week
Hmm.
of so by
Hmm.
day 4, you're able to go out, for this patient. Certainly we kind of recommend, like Adrian was saying that, but by day 5, as you can see, this has been our experience as well. And so this is incredible.
Hmm. Absolutely. Okay, so now we'll look at some before and after photos with 3D Miracle. So here you can see on a lighter skin patient, she has a little bit of texture and pigment, and 1 month post one treatment, and her skin already looks, I mean, 10 times smoother. Fine lines and pigment have really improved. And just that glow is back. This one I love. I think the pigment improvement is amazing, but also just the quality of her skin looks so much healthier, brighter, um, and a lot smoother. Yes, this patient also is fantastic. It's really so 3D Miracle would be the treatment for somebody who wants slight improvement. Maybe you're a little more you're not necessarily 40 or 50 years old yet. You don't have a lot of maturity to your skin, and you just want some slight improvements and like anti-aging. This is what anti-aging is really. It is, she looks beautiful before, but the after is undeniable how smooth and glowy her skin looks. Her pores are smaller. The appearance of her pores is smaller. The pigmentation, the redness is so evened out. She looks great. Love
Yeah,
this.
and I want to point out her skin type is such that you have to be really careful with a lot of different lasers because it can cause some
Hmm.
hyperpigmentation, some problems. But the point of this laser is it treats all of that, and with the 3D Miracle being it's the most superficial treatment, you can kind of see just some of the little texture, a little bit of that color is gone. And my wife, I treated her with this 3D Miracle. She, by self-admission, she's a little bit of low pain tolerance for these treatments that I've done on her. She did no numbing at all. It was straight into it. And by the next day, you could still see some of the problems. By day 3, you couldn't even tell. But she has a few different discolored spots we've been working on. Significantly improved by day 3. I mean, it really
Hmm.
is a miracle. The name is not just clever marketing. It really is good.
Yeah, it makes sense for sure. This is a great one too to highlight kind of what it can do for pigmentation in the skin, and just overall smoothing. I mean, it looks great. This is great again. So this is going to be more of that clear. So we're getting a little deeper into the skin to help more with some deeper pigmentation and fine lines. And you can see an overall improvement in only 5 days post treatment. That is amazing. This one I love. So again, this treatment is safe on all skin types. We have treated just about everybody in the office. And those of you who have been to the office, welcome to our virtual office here. We've treated Bianca, who is definitely a little bit darker than this patient. We've treated Kaylee, who is Guatemalan, and we've treated the lightest of skin types as well. So it's super safe on everyone. And in here, you can really see just the texture and her skin, the smoothness. It's a little tighter, it's a little more plump, and that pigmentation is really gone. And when it comes to darker skin, treating acne and scarring is something that's a little more difficult. So it's nice to have, we waited for an option that was safe on all skin types, and we definitely found that in UltraClear. This is a great one also, really deep pigmentation. I mean, can we say less within? So again, it takes a lot of time. So 4 months, 2 treatments, that one spot is basically gone. So it's not overnight, but the results are definitely life-changing.
Yeah. So the deeper the treatment we can do on certain skin types, some of the pigment can be improved because we're destroying those skin cells that have that excess pigment. So there are lasers that specifically are geared towards pigment, but they're not always safe to do on darker skin types because it can't distinguish between your underlying kind of normal tissue and the skin color and the excess of skin color. And so, but this one, we're not trying to get rid of the pigment molecule itself. We're remodeling the skin. We're allowing it to kind of heal, and that's why a couple treatments. That's why both these, all the other ones we tried like just one treatment, significant improvement. With these, when we're really going towards some of these targeted therapies, we do have to go a couple treatments because, as the video showed, we're just doing a certain percentage of the skin we're damaging. We're leaving most of the skin fully intact, so that as that skin heals, it can heal quicker, and we're able to kind of we can do Foley ablation. We can get rid of all your skin with this device, but we do so in very kind of measured ways so that we can avoid some complications that are unavoidable with other machines that just kind of go through. But this one specifically, when we're dealing with color and some of the deeper kind of issues, we do have to do a series of treatments. I'm almost sure with 3 treatments, this would be pretty much gone. So pretty incredible. Same patient, same idea. So two treatments, significant improvement. That's I'm guessing with her, she had already been on a lot of other treatments for that that mark.
Yeah, and then hands,
please.
I love hands. Not enough people treat the hands. Whenever people remember that they can treat the hands, it's like a light bulb goes off. Nobody treats the hands, so you could treat the hands with this. You could treat the hands with anything, but this is a great treatment for the hands to really like take your hands back in time. Hands always just show so much more maturity, and that is patients tell me that all the time that their hands are showing age. So I mean, add your hands onto your treatment. It's incredible.
So as we get more into the advanced kind of therapies, we're talking more sensitive areas. So around the eyes, kind of in some of these more tightening areas, this is a good example. This isn't a blepharoplasty, right? This is not a surgical removal of skin tightening in this area. As you can kind of see under that on that left picture, a little bit more texture, a little bit more wrinkling under the eye. On the right, that's gone. That's one treatment. That's pretty incredible. Typically for a blepharoplasty, you're talking, upwards of, $5,000 at least for a simple blepharoplasty. With this, this is one treatment. You get significant tightening in this area. Scarring. Another reason I brought this on. I'm a lot of medical patients. I have a lot of acne scarring, and I was kind of getting frustrated. I'd be sending people to other practices with devices, and they'd come back. They just didn't have the results that I was hoping that they would get. The UltraClear. This is a large scar, and with acne scarring, we're going to get into a little bit more. But this is just a demonstration. This is huge for scarring. As you can see, the tone, the texture, the color significantly improved. That is a fully matured scar on that first picture. That looks like it's been there for years. And typically we kind of see this maturation of the scar after about 8 months. That scar ain't changing. Maybe mildly throughout the years, but typically that's a full maturity. As you can see, just 1 month, one treatment, we're starting to see some of that texture kind of come back, some of that color, some of that pull around there. And then, by just 2 treatments, we're seeing significant improvement. And that may not seem like a ton. It's not completely gone. You can never get rid of scarring completely. You just want to blend the borders. You want to kind of just Photoshop it a little bit, and it becomes significantly less noticeable. So this is an amazing result. We also talk about rejuvenation. This patient has some of those discolored spots. It's just one treatment. This is incredible. If you're doing a full resurfacing of the face, full ablation CO2 with a month or around of downtime, you get better results than this. But this is one treatment, 1 month afterwards, significant improvement. Same with this. I mean, this is pretty incredible. There's, as you can tell, as Adriana kind of pointed out, tone and texture of the skin significantly improved. Plus, those sun damaged spots pretty much gone in some of those areas. Again, one treatment, and we typically recommend between 1 to 3 treatments, depending on kind of your goals, and that's why the consultation is super important. There's another also talking about the eyes and the under eye areas. This is one of my favorite treatments for this area as well. As you're seeing, subtle texture improvement down here along the jawline, up here around the eye as well. Again, 1 month, one treatment. This. You don't see these results with that little of downtime and with that short of time between treatments. So yeah, this is I want to get to. This is where a lot of my patients, I think, are going to this is going to change their lives. And acne scarring can be just so devastating, as you can see with her hitting, deep scarring. And that's really hard. That's really hard to get rid of. We can do subcision, we can cut underneath it, we can put filler in there, we can do all those things, but it doesn't necessarily change the tone of the skin. Doesn't really give that tightening. That's just trying to fill in the holes. With this laser, not only you're filling those holes by you're basically puncturing those holes in those scars, getting that skin to kind of remodel and try to rearrange itself to fill in those skin, but everywhere around it, you can tell the little dots, the discolored spots, the lines, the wrinkles, they're improved. And so, I mean, not only is she going to feel like her scarring better, but her face is going to look better. And that's going to be, again, life-changing. So same thing with here. And this is a skin type where you always have to be careful when you're doing resurfacing and deeper laser treatments, because significant discoloration can occur. With this laser, we're not seeing that. And as you can tell, those are pretty, what we call rolling acne scars, significantly improved. As we're talking about, obviously, rejuvenation, this is a great progression. Around the lower jaw, lower kind of lip area, significant little, what we call furrows and rhytids there, improved. 7 days post 2 treatments, post 1 treatment. This is the full face. This is good stuff. This little kid, we kept this in because this is one of my also favorites. The reason it's there, obviously the scar is there. Kids heal pretty well. This scar is pretty significant. I'll tell you, this kid, I know Dr. Kimler did not put this kid under general anesthesia. Most lasers, you got to put kids under general anesthesia. They cannot tolerate it. This was so comfortable. This kid was able to be held by his mom, and he was fine. And incredible results there. So surgical scarring, we do surgery here, face, body, chest. This is going to really help us and help patients that have those deeper scars. So again, really good overall, not just the tone, the texture, but the color significantly improved. This is an incredible photo as well. You can just see the tone, the texture, the tightening of these areas, and most impressively, the sun damage, almost completely gone. To end off, we're going to talk about laser coring as well. So this is a little demonstration of what laser coring looks like and what it is. The sounds, this demonstration, it doesn't look that impressive. Trust me, this stuff is revolutionary. You're able to go down these really deep millimeters. With lasers, we're talking about fractions of a millimeter. With this, you're able to go down deep, and it says coring. Coring is the right word. This goes down deep. So this is where you can get that remodeling of the skin that's deeper, that you're looking for those signs of aging, the lifting, the tightening. This is where that can be done. There are different devices out there. My last practice, we had Elicor manual. Basically, you get like a little punch blade, and you're just putting little holes in people's skin. Very uncomfortable. You got to do a lot of numbing. It's a bloody mess. It was not my favorite treatment to do. This really does that with minimal downtime. This also, I don't have to inject lidocaine into your face. I did this on my mother, and she also, she would hate me to say it, she also doesn't have very high pain tolerance. She's like, oh, that I didn't even hardly feel that. And I was pretty aggressive with her, more than she would have wanted me to. super comfortable. This is where we see some of the most impressive results with this. This is not akin to a facelift. That's not the results you're looking for with this, but significant signs of aging. When we're coring down to your skin, we're really doing some heavy lifting. And this is kind of you can see that lower jawline, focus on that area, as well as kind of that nasal labial fold area, that texture right underneath your eye, all that's gone. All that's gone. And whenever we do coring, we are also doing those more superficial treatments at the same time. That's part of this laser's beauty, is you can go as deep, but whenever you go that deep, you're always doing those. It's like building blocks. You're kind of going the deepest foundational kind of tightening. That's where the laser coring comes from. And then on top of that, you're doing the ultra, the clear, and just that really superficial stuff helps healing so much faster, so much better. So again, looking at some of these areas, neck, we've seen some significant improvement. This is not plastic surgery. We're not going removing skin. You can't expect no skin there, but as you can tell, tightening significantly. Same around that neck area, and the look around these mouths. I mean, this is one of the most frustrating things to be a cosmetic dermatologist, try to treat that. With filler, I'll chase these lines with filler, and that's okay. But man, if we can just clear house, and that's what this allows us to do. It really allows us to get deep, in addition to being superficial as well. So we do it around the eyelids, around the eyes. So you can see in that first picture right below here on those periocular kind of rhytids there, significant improvement in tightening. So I'll let Adriana kind of and Holly take it over here from here.
Fantastic. That was amazing. Those results are phenomenal. I cannot wait to have my treatment done. Okay, so for everybody that's attending with us live today, we do have a special offer. So you will all receive 15% off your UltraClear package. But for the first 5 people to book their treatment, we actually also have a special complimentary gift. And I'll let Adriana maybe explain that a little bit more. And I'll pop that phone number in the chat now so you guys can go ahead and shoot us a text message.
Absolutely, yes. So like we said, your pricing is determined on what exactly it is you need done. This is very customized treatments. So consultation is key. You will get 15% off whatever it is we decide. And then as a bonus, we really want to highlight skin maintenance. Everyone's top question is always, how often do I have to do this? You have to maintain your skin throughout the rest of your life. So we were going to set you up with a Bella MD Hydrofacial, a Revision Vitamin C Serum, and then our Rapid Recovery Kit for your first UltraClear treatment. And this is to make sure that when you go home, you are as comfortable as you possibly can be after your treatment, and you just have a lovely first night rather than being maybe a little hot, maybe a little uncomfortable. We're trying to give you all the benefits you possibly can.
Awesome. That is fantastic. Okay, so now we can get into everybody's favorite time of the webinar, the live Q&A. And the attendees have been very active in listening and sending in questions throughout this entire webinar. So we'll go ahead and get started. Okay, first question here is, what are the differences between UltraClear and the IPL laser, and which patient issues are better for each type of treatment?
I'll let Adriana handle that one. She has a lot of experience with the IPL and the difference.
For sure. So IPL, when we talk about IPL, it isn't ablating the skin at all. If you've had it done before, if you hadn't, it's shaped like a domino, and it is a light that is shining over your whole entire face. With that, it does bring some pigment to the skin. It helps with some redness, but it's not doing anything very deep down, if that makes any sense. So again, UltraClear is removing tissue from the skin to increase that healing at a much more rapid rate. So with IPL is an excellent treatment to prep your skin for UltraClear, but you're not going to get the wrinkle improvement as much with fine lines and texture and lifting that you would with UltraClear from an IPL.
Yeah, and that is exactly right. And to add on to that, it's not safe for all skin types. So depends on what you can. You can't do. So the IPL, the target of the intense pulse light is the color of the skin. Like
Mhm.
she just said, we're not touching, we're not remodeling, we're not bringing, things together. We are just focused on getting rid of that color. It doesn't do anything with wrinkles, maybe a little bit of texture and tone improvement, slight, but the goal is to get rid of like the freckling and the sun damage. The darker skin, you can't do that because it can't distinguish the excess pigment from sun damage and just being a little tanner. So that's what really distinguishes that. So certainly they can be done, as Andre was saying, IPL, great way to prepare your skin for, some of the benefits that you can get from the UltraClear. But and I said it doesn't. The UltraClear can do some of that color, and we see the before and
Mhm.
afters can do that. That's not its main purpose. It kind of does that as somewhat as an additive because we're getting rid of some of those cells that have excess pigment in them. And so we're able to and then the skin heals in normally colored cells that is your normal baseline pigment, and it kind of fills those gaps in, as opposed to just getting after the color.
Mhm.
Fantastic. That was a great explanation. Let's see. We have one question, and I think it might be related to the promo. It says, can I schedule online or do I need to text? I can pop the online scheduler link in the chat if that works for you guys as well.
Yeah, so you can book a consultation. Everything starts with a consultation. Again, with the UltraClear, since there are so many different levels, so much customization we can do to it, and also different levels of if we need to numb you or not numb you. Numbing takes up a long time. So you can absolutely schedule your consultation right now for tomorrow. Come on in. We'd love to see you. And then we can, set you up with everything after that.
Perfect. All right. Let's see. A couple more questions that have come in. How many UltraClear treatments have you guys done?
Oh, excellent question. I think between the two of us, we've probably done like 30 treatments.
Yeah.
Yeah. And
So
then we just got back from Florida and we watched the demo treatment. We learned from other professionals. So we've been really focused on becoming experts at this and like learning everything we possibly can and getting as much hands-on experience as we can. I'm pulling all of the employees every second I can. Like, can I treat you with this? Do you mind? So we definitely are,
what
we're getting our hands on.
one of the cool things is a very active community, which was another important reason I brought on this laser. Things are being tried all the time. There are different protocols. This technology allows us actually. They're adding new and different features all the time to this device, which is incredible. Usually you have to buy another device to kind of get access to these new modes and technology. The Claro is awesome. They're doing a lot of cool things. They're really geared towards patient success. So there's things that are being tried all the time. So like the basic fundamental treatment we've done, like I said, more than a dozen times. Like these are the deeper treatments, the superficial stuff. Yeah, but the things we're working on now are some of these newer kind of protocols, to get some really cool results. That's why Adriana's right. The consultation's key. Everybody's different, and this is not a one size fits all, but
Mhm.
it does allow us to really customize and get down to your goals, kind of what are your goals. And some people, this is not the treatment that would best suit their goals, and that's what we want. We want to make sure that you're not only as an experience, we want to make sure you understand what to expect, because expectation is it can either make or break your experience with this treatment. Just we try to show you those daily kind of photographs of the progression, because we've had some people that we treated that had a different expectation. They were kind of here like minimal downtime. They were thinking they were going to get up and go on their to a ball
Mhm.
the next day and not have any issues. That's not the expectation here. We're going to remodel your skin now, significantly less downtime than other people who've had with other like CO2 resurfacing, like I said. But the expectation we need to set, and sometimes that expectation can be different for every individual patient. So this is this overall introductory kind of a session, but the nitty gritty, getting down to your personalized experience, that's where the consultation is really important.
Fantastic. All right, I have a multi-part question here. I'll break it into a few different ones. It looks like a couple questions about kind of eye safety. Can you guys explain a little bit about the shields that you wear? And is there any risk of eye damage when treating the under eye area? Because I know we can get really close and treat that crepiness there.
Yeah, so that's a great question. So the under eye area is a tricky area. It's something that I do. So we put little eye shields on you. So these are metal shields. They go in like almost like contacts. They have little handles on them. They're kind of cool, little protective things. So they shield your actual eyeball because we're actually able to go up on your eyelid. Now, some people that they don't want to do that. There's significant inflammation with that. It's a little bit more downtime with that, but the closer we get up to your skin here, we're able to pull it down. The beam is not as refractory as other lasers where, you can't really have your eyes anywhere near them. This one, we're able to really precisely get right up to that border line in that area, even without those kind of eye shields in. We kind of are able to kind of keep you covered with some other devices, but it just depends on what your goals are and what the treatments are. If we're mainly going for the eyes, then the eye shields are important. If we're getting up towards the eye, but not necessarily need to get anything with the actual eyelid skin, we're okay getting up close to that. So there again, different ways, but we do have ways to protect your eyes from this device.
Fantastic. Okay, and we talked a little bit about downtime. A couple questions came in regarding kind of the aftercare treatment. Can you guys go over kind of what the regimens are going to look like for patients after they're done?
Yes. So post care is honestly very simple. Like, I recommend people to just stay at home as much as you can. Do it on a Friday, stay home all weekend, because that is the most dramatic moments of the downtime is those first couple of days. Doing nothing. Like, we'll send you home with some gauze and some water and some cream, and that's all you need for a day or two. And then we do try to send you home with a post care kit as well for those next 2 to 10 days: cleanser, moisturizer, serum, and sunscreen. As basic as possible, but also as gentle and, I don't love the word clean, but just as like basic ingredients as possible. We don't want a lot of oils, but we don't want a lot of heavy ingredients that are going to occlude the skin. So we do set you up for full success post care, and everything is just really avoid the sun and use everything that we give you, and you will have no issues.
Fantastic. That sounds easy enough. Okay, so one more question here. How about how long after my treatment can I wear makeup?
Excellent question. We love tinted sunscreens here at Experience Dermatology. Big believers in tinted sunscreens, a BB cream, a CC cream, something with sun protection. Um, and that's really it that I would recommend for the first like 2 weeks. After that, you can wear makeup, but the biggest thing is to get new brushes or fully sanitize and clean your brushes. You cannot, like we said with the Vaseline and the Aquaphor, you don't want something dirty going onto your freshly ablated face. So just making sure that the brushes you use are clean, that the makeup you're using isn't expired, that the sponges you're using have been cleaned and sanitized. Like, as long as the makeup you're using is clean and gentle, you can start to wear makeup after 2 weeks.
Perfect. And oh, sorry, go ahead.
Yeah, no, I was gonna say, like just to point on that, we're creating damage to your skin. So there's little tiny holes. These are these fill in quickly, but if you're thinking you're gonna put on a dirty makeup brush, you're able to seed some things in these areas. That's where I draw on, like our goal is to provide that kind of hand holding after the treatment, which is not there's not much to hold because it's pretty simple, pretty straightforward stuff. And certainly, our goal is to help you to return back to normal activity as soon as possible. 2 weeks is ideal. Certainly, it depends on the aggressive level of therapy. If we're not doing that aggressive, you can go back to a little bit more normal a little quicker. So that's where, again, that consultation super important to kind of help us to give you a clear timeline. The more aggressive stuff, when we're really getting down deep into the skin, we do want to avoid that. Some of those, like the 3D Miracle, you could go back to pretty normal within a week. So it just depends on kind of what your goals are and what your timeline is.
Perfect. Okay, one more that just came in. I feel like everybody's favorite question. How long will we have to avoid the sun after this treatment?
Forever.
Cave dwellers. Yeah.
Yes. I mean, the thing is you don't want to do the treatment on freshly tanned skin, and then you don't want to get tan immediately or soon after. So, you could do it on January 1st, but if you plan to go to Colombia for Valentine's Day, well, that's something to really consider. You don't want to be in the sun for, I would say, like that, like Colombia beach time, like a month
Yeah.
longer, two
So
months
yeah, so it depends. So when you're talking about in the sun, we're talking about like no hat, no umbrella, like just no
at the
protection,
beach.
being out there at the beach, getting water running off your face, stuff like that. So where your sunscreen's uh, non-negotiable in terms of, because if your goal is to have your skin look better, because a lot of times those sun damaged spots are what we're trying to go after. So if that's what you want to get rid of, the reason that we get those is because we've had unprotected exposure to the sun for so many years. So to then go back and do that, it kind of is counterproductive. This treatment is lifelong in terms of the damage that we control and we improve. That's permanent. This is a permanent improvement of your skin. But the thing that's not permanent is getting more additional damage, and also natural aging. Your skin's gonna start to degrade just naturally. So we don't want to accelerate that. We don't want to kind of get your new brand. This is brand new skin. We're not just doing just to get rid of the color. We're getting fresh new skin cells by tunneling these little tunnels in there. So these new skin cells, they're very naive. When they see the sun, they're going to be freaking out. They're going to be like, "Whoa, what's going on?" So they're going to be more prone to discoloration if you're not protecting. Now we talk about protecting: big white brim hat, being an umbrella, and sunscreen. You can enjoy your time on vacations. You can go places, but like, yeah, 2 weeks later, you're not going to want to. If you've been ever had like a
Hmm.
sunburn and like damage, you go out in the sun, you're like, oh my gosh, that's uncomfortable. This isn't exactly like that, but
Yep.
it's somewhat similar to that. So your skin is healing. You gotta let it heal. If you're gonna invest into your
Exactly.
skin health, you're not going to want to go and ruin all that by just throwing caution to the wind. And not to mention skin cancer, prevention. But like I was trying to say, sunscreen, tinted sunscreen, aggressive moisturizing sunscreen, paramount. Shade, sun protection. Be at the beach. Be enjoying yourself. If you have to do, within a month or two, but don't go out and just be, going out with no sun protection, no sunscreen, and that stuff. It's going to you're going to regret it. It won't make your skin. You're not going to come
Hmm.
out worse. It's just you're not going to have the results
It's not
long term.
worth it.
It's not worth it. Yeah.
It's not worth it.
Awesome. Perfect. Okay, we have one more question that popped in. We are at time, but I wonder if we have enough time to address this one. What about any sort of side effects of hyper or hypopigmentation?
I would say that hypo and hypopigmentation is possible with literally anything anybody ever gets done to their skin, whether you're getting your eyebrows waxed or you're getting an ablative laser treatment. Everything is in the hands of the provider to make sure that they are asking the right questions, to make sure that the patient didn't make a mistake, so that I don't now make a mistake, so that now there's a mistake. So definitely consultation again is very key. Provider expertise is very key. That's why we're really trying our best to get as educated and as possible with this. But then also, prolonged pigmentation is something that has been known to happen with this treatment on thinner parts of the skin, whether it's on the sides of the neck or under the eyes or on that jawline. Prolonged hyperpigmentation is common and normal, and it could happen on any patient of any skin type, for up to like 3 months after the treatment. That's just normal. But scarring and hypopigmentation and all of that, we do our best to minimize that and at all costs.
Yeah, so that's exactly right. So we talked about like, this is safe in all skin types, and but it depends on how aggressive we go. There's different factors we have to factor in to protect the skin from certain settings that can cause damage and can cause discoloration. The darker your skin is, we can't fully ablate. We're not getting rid of all the skin. We dial things down. We kind of do it more gentle. We're not using them as much heat. All of those factors avoid or help us to avoid complications. But as Adriana said, we even had a patient that wasn't the darkest skin type, a little lighter skin type. She had some discoloration, and we told her it's possible, but she was a little she wasn't upset. She was just questioning, like, oh, you told me there was no, very little to no discoloration.
Mm-hmm.
That resolved within like a couple weeks after that, and her skin looked great. And so it's about the expectation. There's very little chance that this does anything, that's irreversible, and long-standing. That's not that type of laser for this. But the discoloration, like Adriana said, we've given treatments to people that are geared towards treating discoloration that can cause discoloration in like one of 200,000 cases, and so there's very, very few case reports of this causing any issues with that when used appropriately. So like Adriana was saying, that's why the consultation is important. That's why, we're continuing in this very active community of UltraClear users. And we're contributing to that as well. Being in Atlanta, one of the few people that have it in Atlanta that sees all skin types on a regular basis, we're able to help with those new protocols, the different things that are coming out about how to really get more aggressive therapies in darker skin types. We're not only receiving that information from people that are doing really cool things, but we're also contributing to that, which has been really, really fulfilling for patients, as well as allowing us to really be at the top kind of tier and edge of these therapies.
Fantastic. Awesome. I think that's all the time that we have for questions today, guys. Any additional questions you have, feel free to just give us a call tomorrow. We're happy to address any questions, and hopefully we get you booked for your consultation soon. We'll do a full assessment and match you with the correct treatment. Dr. Iyer, Adriana, thank you so much for your time today. Everybody that attended, thank you so much. This is a fantastic treatment. I can't wait to get mine done.
Awesome. Thank you, Holly. This is great. And thank you for everyone who attended, and I hope to see you soon.
Okay, bye.